I've washed my hands, knock on the door. Hi, my name is Jessica Turner. I will be your nurse practitioner student today doing your assessment. Can you please tell me your full name and date of birth?
David Mills, May 4th, 1994.
So patient is a 30-year-old Caucasian male. He appears to be pleasant and in a good mood. So first I'm going to be assessing the scalp, the head, and the hair. So I will be taking a look. His hair has even distribution. It's brown in color. I don't see any abnormalities of the hair. It looks pretty healthy. There are no lesions in the scalp that I see. Straight for me. So the head is symmetrical in appearance. It is also normal cephalic. There are no masses or nodules noted. Patient denies any tenderness and palpation. I'm going to be inspecting the eyes now. So just take a look at me. Eyes are symmetric. They open and close symmetrically. The eyebrow hair and eyelash distribution is normal. Just going to take a look. So vascularity of the eyes are evenly dispersed. There's no nodules or swelling noted. The cornea appears to be clear. Pupils are about 4 millimeters in size, round and symmetrical. The lenses have no opacities. Take a look at me. So your eyes are brown in color. I'm going to be testing the corneal reflex, which also tests cranial nerve 5. By using a cotton swab. Okay. So cranial nerve 5 is intact. Now I will be testing cranial nerve 2 by doing a visual acuity exam with a Snellen chart. I will be standing 6 feet back. Please cover your right eye with your hand for me and read the lowest line that you can on the chart.
LTFPH.
And please cover your other eye with your hand and read the lowest line possible.
LTFPH.
And now uncover, and with both eyes, please read.
LTFPH.
So patient's eyes are, visual acuity is 20/20. So I'm going to shine a bright light in your eyes. So pupils are both equal and reactive to light. They're symmetric. Please take a look behind me, and now at me, behind me, and now at me. So accommodation, patient's pupils appear larger when he looks into the distance and smaller when he looks at objects close to him. Now I will be testing the corneal light reflex by performing the Hirschberg's test. So please look straight. Okay, so light reflex is normal. It's centered on both pupils, and so the pupils are equal, round, and reactive to light and accommodation. So now I'm going to be checking your visual fields. This checks cranial nerve number 2. I'm going to have you cover your right eye and stare at my nose. You're going to be telling me what numbers you see holding up, okay?
1, 2, 3, 4.
Okay, now do the same with your other eye. Stare at my nose.
1, 2, 3, 4.
Okay, perfect. Visual fields are intact. Cranial nerve number 2 is intact. I'm going to be further evaluating your eyes with my ophthalmoscope. I'm going to have you just look straight and past my shoulder, okay?
Okay.
Okay, so red reflex is present. I'm going to be checking the fundus. I'm going to also follow the blood vessels to the optic disc. Okay, appearance is yellow, yellowish orange in appearance. and there are sharp margins. There are no abnormalities noted in the retina. The retina vessels appear well distributed and they are intact. I'm just going to look a little bit more. Okay, so the macula is yellow and is surrounded by very deep pink, and the fovea is in the center and it's also intact. This is bilaterally, and the right and left both appear normal. So now I will be inspecting both of your ears with my otoscope. I'm going to just pull the pinna up and back. Okay, I'm going to also examine your ears. Is there any tenderness?
No.
So ears are symmetrical. They're in line with the outer canthus of the eyes. There are no lesions or deformities noted. Patient denies any tenderness to the ears. The ear canal appears to be pink with minimum cerumen noted. There's no discharge, foreign bodies, or redness. The tympanic membrane was intact and translucent, pearly gray color. The light reflex was present, and there is no redness or swelling in the canal. So now I'm going to be testing cranial nerve number 8. This is going to be a whisper test. I'm going to have you cover your left ear, look straight, and I'm going to be standing 2 feet behind you. You tell me what words I'm saying.
Okay. 1. Apple. Orange.
Okay, perfect. I'm going to have you cover your opposite ear.
Dog. Cat. Rabbit.
Okay. The whisper test was conducted and hearing in both ears were normal. Now I'm going to be performing the Weber test. I'm going to be using a tuning fork. I'm going to place it on top of your head, and you're going to tell me if you hear the chime in one ear versus the other, or both ears,
Okay.
and when it stops. Okay?
Okay. Stops.
Okay. And did you hear the chime in one ear versus the other, or did you hear it equally in both ears?
Equally in both ears.
Okay, perfect. Now I'm going to be performing the rind test. I'm going to place it behind the mastoid bone. You just tell me when you stop hearing the chime, okay?
Okay. Stop. Stop.
Okay, perfect. And I'm going to be doing that also on your other ear. So
Stop.
and tell me when you hear it stopping again.
Stop.
Okay, perfect. So that concludes the rind test. There is good air conduction, and air conduction was twice as long as bone conduction. So the Weber, rind, and whisper tests were normal. Okay, so now I will be inspecting, palpating the nose. From the external nose, there are no deformities noted. The skin is intact, and there are no lesions or nodules. I will be now palpating the nose. No deformities noted, no tenderness noted by the patient. I'm going to be palpating the frontal sinuses and the maxillary sinuses. Do you have any pain
No.
when I touch them? No? Okay. So no tenderness noted to the sinuses. I will be percussing. Okay. Percussion provides a dull noise. I will be now taking a look in the nares with my otoscope. Okay. So nares are pink in color. There's no obstructions or foreign bodies noted. There's no swelling or bleeding. I'm going to be checking for your airway flow. So just breathe in and out. Okay. Okay, perfect. So there are no obstructions in the right or left nair. Now I will be testing your cranial nerve number 1. I'm going to have you close your eyes and tell me what you smell.
Lemon.
Okay, so cranial nerve number 1 is intact. So now I will be inspecting the mouth from just taking a look at the lips. The lips are symmetrical, they are pink in color. There's no ulcerations or lesions noted. I'm gonna have you open your mouth for me. Okay, and say ah.
Ah.
Okay, uvula is midline. There's no exudate in the pharynx. The palate is intact. Tongue appears to have no lesions. It's midline. The gums are intact. There's no bleeding or swelling noted. Teeth are also intact. I'm gonna have you take your tongue and put it to the top of your mouth. Okay, so cranial nerve 11 is intact. The posterior pharynx looks good. I will now check cranial nerve number 10 by checking the gag reflex. Say ah. Okay, so gag reflex is intact and the uvula is midline. Okay, so now I will be inspecting the patient's neck. So I'm looking at the skin. The skin is intact. There are no pulsating arteries that I notice. There are no lesions. Upon palpation, I don't feel any masses or nodules. Do you have any tenderness?
No.
No? Okay, the trachea is midline. Can you swallow for me? Okay, so swallowing is intact. Patient does not have any signs of dysphagia. His thyroid gland is normal and midline with no masses noted. I'm going to palpate for the carotid pulse. Okay. So pulses are 2+. I'm also going to check for range of motion. So please lift your head up and down, left and right. So range of motion is intact in the neck. I'm now going to palpate for lymph nodes. So I'm going to be looking for the preauricular, the postauricular, the occipital. I'm also going to be looking for the tonsillar. I'm going to be looking for the submandibular, submental. We're going to be looking for the posterior cervical, and the deep cervical, and then the supraclavicular. So there are no, there's no swelling of the lymph nodes or tenderness noted. So now I will be observing and inspecting the patient's anterior chest. So can you please lift your shirt up? Patient's skin appears to be pink in color. Let me see your arms, please. Okay, turn your hands. Okay, so skin is pink in color. It's warm and dry to touch. Can I please see your fingers? Okay, so capillary refill is less than 3 seconds. The nails appear to be convex in shape with no abnormalities or splintering of the fingernails. I'm looking at the lips, the nares, the nasal mucosa, and lips are pink in color. There's no cyanotic appearance noted. The thorax appeared to be symmetrical, and respirations were easy. I'm now going to be observing your respirations, so I'm going to have you just look straight and just breathe normal for me. Okay, so respirations were 16 per minute. There's no labored breathing. Patient is not in any respiratory distress. and chest appears to be expanding symmetrically. So now I will be checking for tracheal positioning by palpation. I'm also going to be palpating the anterior and posterior chest. So first I'll start by palpating the tracheal positioning. So the trachea appears to be midline. There's no abnormalities or deviations there. I will be palpating the anterior chest. Okay, so the skin looks intact. Okay, skin is warm to touch. There are no nodules noted. There's no skin abnormalities noted and no tenderness upon palpation. I'm going to be checking for chest expansion. So I want you to just take a deep breath in and out. Okay, and in and out. Okay, so chest expansion is symmetrical. There's no labored breathing. Now I will be checking for tactile ephemeris of the anterior chest. So I want you to say the words 99.
99.
Okay.
99. 99.
Okay, so tactile ephemeris of the anterior chest. There is vibrations throughout. Now I will be just assessing the posterior chest. So I'm going to have you just spin around for me. Okay, so I'm going to be just taking a look at the patient's skin of the posterior chest. There's no redness, lesions noted, no masses or nodules noted. I will be palpating. Okay. So upon palpation, there are no abnormalities noted of the posterior chest. I will be checking posterior chest expansion. So I'm going to have you just take a deep breath in and out. And again. Okay, so chest expansion of the lumbar spine is symmetrical, no abnormalities noted. I will be checking tactile ephemeris. So just please say the words 99.
99. 99. 99.
Okay, so tactile ephemeris noted with vibrations throughout all lung fields. You can place your shirt down. So now I will be performing percussion over the patient's lung fields. So resonant sounds were heard in all fields, which is normal and expected. So now I will be auscultating for lung sounds in the anterior chest. So I'm going to place my stethoscope on your chest and I'm going to have you breathe in and out. Okay, so normal breath sounds throughout all lung fields of the anterior chest. There's no adventitious lung sounds noted. Lungs are clear. So now I will be auscultating with my stethoscope the lung fields of the posterior chest. So same thing, I'm going to have you take a deep breath in and out. So lung sounds of the posterior chest, clear in all fields. There's no adventitious lung sounds. Lungs are clear. So now I will be assessing for diaphragmatic excursion. I'm going to ask you to just breathe normal. I will be percussing down your back to find your diaphragm. Okay. Okay. So now I'm going to just have you take a big deep breath in and hold it while I percuss further. So you can exhale. So the diaphragm is about 4 centimeters from when he is not holding his breath from when he is holding his breath. So I can. Okay, so now the cardiovascular assessment, we're going to start with inspection. So I will first be inspecting his face and his neck. So I don't see any vascular abnormalities. The skin is intact. I'm taking a look at his neck for any jugular vein distension or pulsations of any of the vessels. So just turn your head this way a touch. Okay, so there's no pulsations noted. I'm just taking a look at the skin on his arms. The extremities look good. I don't see any vascular abnormalities. There's no edema of the upper extremities. I'm going to take a look at your fingernails. So the fingernails are convex in shape. There's no nail abnormalities. There's no splitting of the nails. Checking capillary refill. So capillary refill of the fingers are less than 3 seconds. I'm going to take a look at the lower extremities, and just by visualization, I don't see any vascular abnormalities. The skin is also intact, and it's warm and dry to touch, and there is no edema noted. So we're also going to visualize the precordium. This can be assessed by just looking at the 4th or 5th, between the 4th and 5th intercostal space, mid-clavicular, and that's just basically looking for any pulsations. Just by looking in that area, I don't see any lifts or heaves, and everything looks within normal limits. So next I will be assessing the carotid pulse. Okay, so the carotid pulse seems to be normal. It's 2+, and there are no abnormalities noted. So now I will be palpating the 6 major arterial vessels. So can I please see your arm? Okay, so I'm going to be assessing the brachial, the radial, ulnar pulse, popliteal pulse. Okay. I'm going to be assessing the posterior tibial pulse, the dorsalis pedis pulse. So all pulses are 2+, there's no abnormalities, and they were felt with ease. I'm going to be assessing capillary refill of the fingers, so can you please post your, yeah. Okay, so capillary refill of the fingers is 3 seconds. Capillary refill of the toes, 3 seconds. I'm feeling for edema. There is no edema noted in the lower extremities. So the last portion of this examination for the cardiovascular system is going to be auscultation. So I will be using my stethoscope. I will first assess the aortic valve heart sound with my stethoscope at the second intercostal space. Right sternal border. Then I will be listening to the pulmonic valve, which is second intercostal space, left sternal border. Then I will be assessing Erb's point, which is third intercostal space, sternal border. And I will be evaluating the tricuspid valve, which is fourth intercostal space, sternal border. And then I will be evaluating lastly the mitral valve, which is the fifth intercostal space, mid-clavicular. This is also the point of maximal impulse. Heart rate is between 60 and 100 beats per minute. It is normal, it's 2+. There are no irregular heart sounds. S1 and S2 are heard throughout all fields. So this is the conclusion of my examination of my lovely patient David. He is in good health, and all exams appear to be within normal limits.